Most psychiatrists, most therapists are really good at the clinical side, and we're not taught the business side or the operational side or the sales side or the marketing side. And so that's what SimplyPsych is good at. It's really good at the operational side.
This episode is sponsored by Therapy Notes, therapynotes.com. Be sure and check them out, and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the PsychCraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Everyone, and welcome to the podcast. I'm Gordon Brewer, and this is episode number 310 of the Practice of Therapy podcast. So glad you're with me, and happy holidays if you're listening around the holiday season. This particular episode is going to be the last one. It's going to wrap us up for the year. I'm going to take a couple of weeks off and try to spend the holidays with family and such. But yeah, I'm looking forward to you hearing my conversation with Dr. Brian Dixon. And Dr. Dixon is a psychiatrist, and he is the founder behind SimplyPsych. And you're going to get to hear more about that and just why he started it and what it's all about. One of the things that is also exciting about SimplyPsych is that they have a new podcast, and it's called Psychiatry Naked. And they are part of the PsychCraft network, which you've heard more and more about. They're probably the newest member of the network, and I'm really excited for them to join us as they launch their new podcast. They are, so they're going to be a great addition to the network. And again, I'm thrilled that they are part of all of this with me. But so as we wind down the year, this is for me personally has been a tough year. I think I have shared with most everyone that not to bring the mood down too much, but my wife passed away on November 22nd of this year, 2023. And so I've been dealing with grief and dealing with all of that. And one of the things that I started as a project to mainly, fairly selfishly, to kind of help me deal with my own grief. In my own practice, that's one of my niches, is specialties, is dealing with grief and helping people make it through the grieving process. And so I'm experiencing it myself firsthand. And I will say that I know all the stuff. I know what's happening to me. I know how it's progressing, and I can see all that. But when you experience it and actually feel it, it's a different thing. So anyway, I'm chronicling all of that as it happens for me and putting it into a video series that I'll probably eventually turn into just kind of like a mini podcast. But the title of it is Love and Loss. And by the time you hear this, there'll probably be a couple of episodes out there on that. But you can find it on YouTube, and I'll have links here in the show notes and the show summary to get you to the playlist for that. But anyway, I'd love to get your feedback on that, and I'd love to hear from you. And for those of you out there that are maybe experiencing some grief as a therapist, I'd love to just touch base with you, because I think we can be of support to each other. And I know that in my own journey, having the support of others is so, so important. And it's really one of the reasons that I do the practice of therapy anyway, is to give people support. And so anyway, I'll I'll put that out there to you. And again, for those folks that have reached out to me and offered their condolences, so appreciate that. And and so on to a new phase of life. Not sure what all the future brings, but I'm going to make it through it, and I'm going to be there, and I'm going to continue to do what I'm doing here with the podcast and the PsychCraft Network. And for that, I'm hopeful and optimistic. And so I'm moving through this process. So, but again, didn't mean to bring it down such a notch when you talk about grief, but it is part of life. And so in my conversation with Dr. Brian Dixon, we're going to talk about SimplyPsych and really the whole backstory behind all of that. And I think you're in for a treat. He is just a wonderful person. And I really enjoyed my conversation with him and getting to know him. He's the real deal. So without further ado, here's my conversation with Dr. Brian Dixon. And before we get to that, love for you to hear from our sponsor, Therapy Notes, along with one of the members of the PsychCraft Network.
Hi there. I'm super excited to welcome you back to the brand new season of Scaling Therapy Practice podcast. This is the show where we encourage you to take deliberate steps towards sustainable growth. I'm your host, James Marland. In season 2, we're specifically focused on one main topic: marketing for mental health providers. Every week, we're going to share about different parts of marketing, giving you simple tips and tricks to grow your mental health business. Every episode from season 2 will have a download or a handout from the show. So sign up for our newsletter so you don't miss these valuable resources. Good news, I'm not going to be doing the show alone. I've got some awesome friends who are going to be joining me from the PsychCraft Network. You're going to hear from Lisa Mustard, Steve Bisson, Dawn Gabriel, and other special guests. We've joined forces for this season to share helpful advice on things we've learned and even the mistakes we've made so that you don't have to make them. As the weeks go by, listen to us cover lots of topics on marketing, such as social media, how to market your own therapist, how to speak in public, and even how to start your own podcast or even just guest on podcast shows. We really want to hear from our listeners, so send us your questions, your comments, your thoughts to james@coursecreationstudio.com. That's james@coursecreationstudio.com. Make sure you check out season 1, which is out now, and it has lots of tips on scaling your therapy practice. Just go to coursecreationstudio.com and click the podcast section. So join us every Monday. We're going to learn a lot about intentional and sustainable growth for your therapy practice.
Have you ever wished your private practice could run as smoothly as a well-oiled machine? Well, look no further, because Therapy Notes is here to revolutionize your practice. Therapy Notes is the complete practice management system you've been dreaming of. With everything you need to manage patient records, schedule appointments, meet with clients remotely, create rich documentation, and handle insurance billing, it's your secret weapon for a smoother practice. And the best part? It's accessible wherever and whenever you need it. Yep, even on the go. Imagine having more time for what truly matters, your clients. It's like having an extra set of hands, but digital. And here's the kicker. It's the very EHR Gordon relies on in his own practice. So, you know it's the real deal. Say goodbye to paperwork nightmares and hello to more time and better quality care. Check out Therapy Notes today at practiceoftherapy.com/therapynotes. Oh, and don't forget to use the promo code GORDON to get 2 months free. That's practiceoftherapy.com/therapynotes with the promo code GORDON. Enjoy the show.
Well, hello, everyone, and welcome to the podcast again. And I'm really thrilled for you to get to know Dr. Brian Dixon, who is a new friend of mine, and also we'll talk some more about this, but his company, SimplyPsych, is also joining the Psychcraft Network with their own podcast. So more to come about that. But Brian, welcome.
Thank you so much for having me, Gordon. I appreciate it. I'm super excited to be here.
Yes, yes. And so as I start with everyone, why don't you tell folks a little bit more about yourself and how you've landed where you've landed?
Yeah, so I am the baby of 5 kids, born in a small East Texas town called Lufkin that nobody's ever heard of. I finished high school there and then went off to college at Baylor and then med school at A&M, Texas A&M. And then I went up to the University of Kentucky, which is up near your neck of the woods, for psychiatry residency. And I did a residency in psychiatry, child psychiatry, and adult and pediatrics. So I covered all three. And then came back to Texas, and I made that huge mistake of working for somebody, Gordon. It was, I tried for years and it just wasn't working. And so went into private practice in 2014. And then out of that private practice in 2021, we created a company, a practice administration company called SimplyPsych. And so I'm really excited to share all what we do there. But I still see patients literally almost every day in my private practice. So I'm kind of wearing two hats.
Oh, wow. Yeah, that's yeah. And I'm really looking forward to hearing more, just because you've been there in the trenches, like a lot of us in private practice, and particularly on learning more about the psychiatry side of things and how that maybe is similar and different in just in private practices. So, yeah. So tell us kind of how you landed on SimplyPsych and what was it that led you kind of down this path?
Yeah, so I made a whole bunch of mistakes. I joke with my friends, I like to make really expensive mistakes. And so when I was in private practice just by myself, I hung a shingle. I just picked some numbers out of the air as to what to start charging people. I threw together some processes. I think I was using, back in 2014, I was using Adobe and like Wix and not recognizing anything about like HIPAA stuff. Like I was just doing the best I can to just cobble things together. And for years, not only I think I was doing really good clinical work, but the administrative side was literally eating me alive. I was using one credit card to pay another credit card. I had no money in the bank. All of my taxes were messed up. And trust me, you don't want to get the letter from the IRS going, hey, you did this wrong. And that has happened to me a couple times. And so once I figured all that stuff out, I got some business coaching and things started working more smoothly about 2017, 2018. And then when the pandemic hit, I thought, wait a minute, I'm doing well enough now that I can share these business ideas, these business systems and infrastructure with other people. And that's where SimplyPsych came from.
Yes, yes. So tell us more about SimplyPsych.
Yeah, so it's we call it a practice management company, but is basically one of our taglines is drop the ball, right? So you're already dropping the ball anyway. Most psychiatrists, most therapists are really good at the clinical side, and we're not taught the business side or the operational side or the sales side or the marketing side. And so that's what SimplyPsych is good at. It's really good at the operational side. So all that crap that you really hate doing, like I cannot stand to talk on the phone. I just can't deal with it. I will text you, but I don't like to talk on the phone. So like scheduling and rescheduling and managing leads and managing refill requests as a psychiatrist, we get tons, probably 50 to 100 refill requests every day. I don't want to have to deal with all that. And so SimplyPsych employs virtual assistants, medical assistants, and administrative assistants to do all of that back office stuff so that then the clinician, whether you're a therapist or a psychiatrist, you don't have to worry about that part. We take care of that part for you.
That's great. That's a great concept. It's as I was thinking about and building my own practice, those are things that I had to figure out on my own. And I wish I'd had something like SimplyPsych to be able to handle that on the back end earlier on. I've had several conversations with other people on the podcast here recently just about the kind of the downfall of bootstrapping, because I think, maybe in those beginning stages when you're not as busy, bootstrapping makes sense. But once you start getting busy and you try to bootstrap, things do fall through the cracks and you just really are up to your neck and stuff and really not sure how to get out of it.
Yeah, and it can get really lonely. So like when I was bootstrapping and I was again using one credit card to pay another credit card, I was looking around for help and there was like nobody to like just peer wise to say, hey, this is something that you're going to go through if you do it by yourself. And so I wouldn't say I got depressed, but I definitely like collapsed inside myself going, man, I'm terrible at this. I'm not worthy. Imposter syndrome set in. This is never going to work. And so luckily somebody handed me a copy of a book called Traction by Gino Wickman. And he talks about the importance of like business operating systems. So I used that for a while. And then somebody introduced me to a business coaching group called Entrepreneurs Organization. And that helped solidify. It got me around other people that are in the same boat, that are, trying to bootstrap things. And then they realize, oh, wait, no, there's a method to the madness.
Yeah. Are there any kind of big aha moments that you can look back at? I know this is a broad question, but aha moments you can look back at to say, oh, I get it now. And oh, this is how it needs to be done.
Yeah. So one of the biggest things that we do wrong as therapists and psychiatrists is we undervalue ourselves. So when I first started my practice, I chose a price guide, a price list that was actually kind of basically a discount built in. And for months, I mean, I was out there beating the pavements. I was networking. I was taking, buying edible arrangements. I was going to doctor's offices. I was going to therapy offices, blah, 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 and doing all the things. And it felt like I wasn't getting enough kind of traction. And I was actually talking to my massage therapist because I was playing volleyball at the time. And I told him what I was doing and what I was charging. And he was like, dude, your prices are too low. And I was like, what do you mean? I want people to come and see me. And he was like, no, people see that and they see you. And with the stigma of mental health anyway, they're going to start to think that you're not worth anything. And I was like, okay. And so that was one big aha moment. I took a deep breath and I raised my prices and I started to get more and more full. And then I raised them again and I got more and more full. And I was like, what is this? So that is one of the first things I tell people is more than likely as a therapist or psychiatrist or counselor, you're probably undervaluing yourself and that's creating your own issue.
Yeah, I think that is so true. That is so true. Yeah. So tell us more about your practice since you're wearing two hats. You're doing this whole administrative endeavor and then your practice itself.
Yeah. So Gordon, I have the best job in the world. So as a psychiatrist, I get to, learn about the body systems and biochemistry and pharmacology and all that stuff. But I love seeing patients. It is fun to be able to have a patient come in. I do kind of some basic therapy. I am not as well versed in therapy as Gordon or the rest of y'all, but I do all right. So then I get to blend some basic therapy with, just kind of, I wouldn't say advice, but as, common living suggestions. And then if I need to overlay medicines, I do that. So right now, there's me and then I have 4 other doctors that work in the group and we're a direct pay practice. So we don't mess with insurance. And what that does is it gives us time to, our tagline for the private practice is that you get our undivided attention. And so during the time that you're with us, I can give you my all. I don't have to go through an insurance company. I don't have to justify what I'm doing. I block everything out. I stay present in the moment. I get you feeling better and then I get you out of my office.
Right. So, yeah, I would guess for somebody like you that's a psychiatrist, how was it that you made the decision not to go with insurance panels and that sort of thing?
Yeah, I'm a terrible employee, Gordon. So I don't like being told what to do. And so that's why I needed to start my own practice. But insurances have this unique ability to start telling therapists and psychiatrists what to do. Hey, you can't code that many times. Oh, wait, you didn't spend enough time to code these 2 things together, or we're not going to pay for this particular visit because you didn't put a code on there. Right. And I think all that stuff is just super dumb. It's real dumb. And so I said, you know what? I don't want to deal with that. The risk is I did not have a ready-made group of people to pull from, right? So that's the benefit of being on an insurance panel is that they have, 2,000 people that they can just shoot your way. But I said, you know what? I'll suck it up and deal with it. And it was one of the best decisions I've ever made in private practice.
Right, right. What were some of the marketing things that you found most helpful and successful for
Yeah,
your practice?
it took me a long time. And again, I wish somebody would have told me this, which is just go make connections. And especially so the city
Mhm.
that I'm in, Fort Worth, it is a very relationship heavy town. And it may be different for different cities across the country, just depending on kind of the feel of where you are. But yeah, like literally just going to the old school networking, showing your face, shaking a hand, giving them a card, especially from other therapists. So me trying to get in front of a lot of the medical doctors, it was time consuming and kind of pointless because
Mhm.
they have gatekeepers, right? They have that front desk person and they wouldn't even let me back. And I was like, dude, y'all, I'm a medical doctor just like Dr. So and so. And they were like, yeah, we
Mhm.
don't care. And so
Mhm.
yeah, so just doing kind of word of mouth referrals from other therapists was the absolute best. And then that
Mhm.
was followed closely by there are lots of Facebook groups out there that are kind of patient driven. So either they are diagnosis driven, like anxiety group, or they are parent driven, or they are location driven. And so if you
Mhm.
can find ways to tap into those networks that already exist, that's also a great way of getting patients or clients.
Yes, yes. Did you find LinkedIn helpful in that kind of that situation?
Yeah, good question. Not as much for patients. We did
Mhm.
do a little, we ran a few Google AdWord campaigns, and that was helpful for a short time. The
Mhm.
the hiccup with Google AdWords is that you get everybody and quite a few folks who aren't in your target audience. And then you'll spend a whole bunch of time basically disappointing people going, hey, I'm actually, I don't take insurance. I'm out of network or whatever. And then we have found LinkedIn to be helpful for the B2B side. So, and so the
Mhm.
B2C side, so B2B side and getting other practices that are interested in SimplyPsych, we have found
Yeah.
that to be very, very helpful.
Yeah, yeah. So here's a question that probably comes up for a lot of clinicians when you in kind of the administrative side and the intake side of things with clients, and you get that pushback around, well, do you take insurance? What 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 has worked for you just around that whole
Yeah.
pushback?
Yeah.
Yeah.
So the first thing is I'm very direct with that. I say, yes, I can't take insurance because if I take insurance, I'm not able to do what I need to do for you. And
Mm-hmm.
then, so that's number one. Another way I phrase it is, yes, I don't take insurance. And yes, I'm out of network. And yes, I'm pricey, but this is an opportunity to invest in yourself.
Mm-hmm.
And then if they really push back and I go, well, I can take insurance, but I'll only be able to see you for 5 minutes and you will have to fill out a lot of forms before you come. And then I'll have to see you every single month because at the end of the
Mm-hmm.
day, the bills have to get paid one way or another. So if I take
Mm-hmm.
insurance, I'll see you in less time more often, or I can see you just pay me directly and I can see you less often
Mm-hmm.
and for a longer time. But either way, there ain't no magic to this stuff.
Right. Right. Yeah. And I think that's a something that people have to weigh out for themselves, and that there's,
Mhm.
on one hand, like you mentioned earlier, the advantage to having accepting insurance is you have a ready-made client base to some degree.
Mhm.
I think too, you have to weigh out the demographics of your area, because there are some areas in the country that having a completely private pay practice is going to be a real hard uphill climb
Mhm.
as far as getting the referrals that you need to sustain a practice.
Mhm.
Yeah. Yeah.
Yeah.
So,
Yeah. That's very true. And it's one of those things where I've become more of a capitalist and an entrepreneur from doing this stuff. And if you find that there is an obstacle, my thing is always there is money out there and there are people who need you. So be creative in how you find those people and they will give you their money. So it could be that
mm,
hey, the traditional approach of I see you for 45 minutes and, and try to charge you cash, maybe that doesn't work. Maybe you switch to productize your service, right? So you do classes, you do coaching,
mhm,
you go out and give free lectures. But the funniest thing is one thing that I've learned is that people will pay you if they feel that you're bringing them a value. Even my folks, when I first started, I had quite a few folks who were on Medicaid, which is, I think different states call it different things, but and they were still able to come and see me. And yes, I made an effort to say, hey, I'm out of network. I don't take Medicaid. I don't take Medicare, but I will work my butt off to keep you out of my office and to make sure that you still feel heard. And those folks would save their money and see me twice a year. And then they would message me in the meantime. So, I mean, there are people, regardless of what you think their circumstance is, people really, really want good care and they are really willing to pay for it.
Right. Yeah. And I think that's an important thing to remember, and just thinking about not getting too much into a scarcity mentality of thinking, okay, if I don't take insurance, I'm going to miss out on a bunch of stuff. But there are people that are willing to get a different level of service.
100%.
Yeah. So to switch gears a little bit, tell folks about SimplyPsych and all that you put into that to create it and how it works.
Yeah, so SimplyPsych is a practice management company that our goal is to give clinicians, mental health clinicians, back their time and their sanity. How do we do that? By doing all the back office stuff. So anytime we engage a mental health clinician, our job is to figure out what you're doing well, because there are always things that are going well in a practice. And then we add in all the stuff that we've learned from all the mistakes that I made over the years. And so we build those customized solutions of operations, of marketing, of sales, and finance. All the back office business stuff. We build customized solutions for that particular practice. So, for my practice, there are 4 doctors, we're super busy, and that is a very different practice than the solo therapist who's down the street from us, who is direct pay, works with families, and he only needs us to do part of the things, which is like answer the phone calls and get people scheduled. And that's it. He doesn't need us to do anything else. And so we offer a fractional rate. So we just charge per hour, and we send you a little invoice at the end of the month. And then, it just depends. We want to be flexible to whatever the situation is that the mental health clinician is in. So it's just it's all the boring stuff that will trip you up. Yeah.
Right. So what are the different areas of that besides, of course, obviously, intake coordinators, I refer to it, intake coordinators that answer the phone calls and schedule people. What other things do you provide besides those kinds of things?
Yeah, so we group all of that into operations. So new leads or intakes that come in, processing those, getting them scheduled, sharing your company philosophy of how you want to do things. So for example, every person that schedules with me, we do a 50% prepayment, like reservation payment. And so we share all of the policies and procedures on how to make that happen. Other practices that we work with, they do a consultation call. So the operations side will match whatever the practice desire is. And then the interim care. So all the things that happen in between appointments. Oh, I need this FMLA form filled out. I need this school note. Hey, can my cousin wants to come and see you or whatever. We can handle all of those kind of in between appointment things. So that's the operations side. And then financial. So if you need help tracking down accounts receivable, hey, somebody didn't pay, that credit card was declined. Oh, the card that was on file the expiration date is now changed. That kind of financial side. We don't do bookkeeping. We leave those to bookkeeping and taxes. We leave to the CPAs. So there you go. And then we do marketing. So for some folks, they're like, hey, I just need to get my name out there. I need a website. I need brand and logo. We do the basic versions of those things. We're decently good with our graphics and whatnot. Our main focus is the operations side of things. But and so I wouldn't say we're a one-stop shop for all things, because there's certain things we absolutely just don't do. And we tell folks, don't come to us for taxes. Don't come to us for, hey, how do I set up my company, LLC, PLLC? Well, I'd say go talk to your lawyer about all that stuff. But once you get something going, we can help you continue it and hopefully get you out of the administrator seat so you can have more time off, because we don't want people to burn out, and burnout is really, really high for us.
Right. Yeah. And I think that this is going to be a really good fit for folks that just really don't feel like they want to put the time or the effort into trying to learn all the administrative tasks and that kind of thing. It's kind of a done for you kind of service.
100%. Because
Yeah.
I tell people this, and sometimes they think I'm being hyperbolic, but I'm like, every time you burn out as a therapist or a psychiatrist in private practice, it creates this ripple because all the
Mm-hmm.
people that you're no longer working with, I mean, there's some I wouldn't say egoic injury, but it creates a ripple. And those folks go, well,
Mm-hmm.
my last therapist left. Well, I'm not going to trust the next person, even though I didn't do anything. That wasn't my fault that happened. Well, if
Mm-hmm.
I, as a clinician entrepreneur, can jump into the marketplace and say, hey, let's keep as many practices open and healthy as possible, we all win. So that's what we're trying to do with
Mm-hmm.
the SimplyPsych side of things.
Yeah. Yeah. That's great. That's great. So, Brian, one other thing before we just kind of wrap things up,
Sure.
you've got plans for a new podcast coming out. So tell folks about that.
Yeah. So the name of the podcast is Psychiatry Naked, not Naked Psychiatry, because that would be weird, but Psychiatry
Uh-huh.
Naked. And the whole idea of Psychiatry Naked is that most people have no idea what psychiatrists do, who we are, or they have a really dated outlook of psychiatrists. So it's the kind of old white dude wearing the tweed coat with the patches on the
Mm-hmm.
arm and the
Mm-hmm.
gray beard and and laying on the couch, and I'm
Yeah.
like, yeah, I'm not that. So
Yeah.
and so I
Right.
was like, let's put together a podcast where we talk about not only, the basics of what it's like to be a psychiatrist, but what about the importance of the business side of psychiatry, the human side of psychiatry, because a lot of how I grew up informs how I practice and who I am. So yeah, so
Mm-hmm.
y'all get to hear about all that good stuff on Psychiatry
Yes.
Naked.
Awesome. Awesome. And as I mentioned earlier, the podcast is going to be is part of the Psychcraft Network. And so there's more to come on that. And those of you that are listening to this podcast are going to get to hear more about that and be able to tune in. I'm excited about it. Looking forward to listening to it.
Yeah, I'm
Yeah.
excited too. I thank you for letting me be part of the network. I'm
Yes.
looking
Do,
forward to it.
do you have a release date yet of when
Yeah,
the podcast is going to be available?
yeah. So we've dropped our first episode, I think last week. I need to check and make sure. So one of my rules
Okay.
is do what you're good at, don't do what you're not good at. And so I'm
Okay.
letting my marketing team do all of that. So I think we did a soft rollout to make sure it actually posted on like the different
Okay.
platforms. But
Okay.
yeah. So you'll see more episodes soon.
Yes, yes. So, well, we'll be sure and make sure people know about that in our newsletter and everything else so that they'll be able to access it.
Perfect.
So, tell folks how they can get in touch with you, Brian, and if they have any more questions about SimplyPsych and the podcast and that sort of thing.
Yeah, so if you go to simplypsych.com, that's our webpage and our main epicenter of where all things are happening. That's where our blogs are. You can sign up for our newsletter. You can follow us on all the social media. So that's simplypsych.com. And then I'm super active on LinkedIn. So if you just Google Brian Dixon on LinkedIn, you'll see SimplyPsych. You'll see all the other stuff that I'm up to. And I would love to hear from you. So my DMs are open, as the kids say nowadays.
Oh, awesome. Awesome. Well, we'll have links in the show notes and the show summary. So, folks, be sure and check it out. And Brian, I hope that we'll have you back on the podcast here before long. Well, I hope you enjoyed hearing from Dr. Brian Dixon, and I really am glad to be getting to know him, and I'm so excited about him being part of the Psychcraft Network. And and so be sure and go check out SimplyPsych and check out his podcast. It's out and released. I know as we recorded this, the podcast had not released yet, but it's out there and you can find it wherever you listen to your podcasts. And we'll have links here in the show notes and the show summary so you can get to that easily. And I hope you have the happiest of holidays. If you're hearing this before the holiday season or in the middle of the holiday season, and I'm really looking forward to being back with you in 2024. Like I said, we're going to take a couple of weeks off from releasing the podcast, but I've already got episodes lined up for the new year. We've already recorded them. So we've got those in the queue, and we'll be getting those out after the first of the year. And again, thanks for being who you are, and thanks for being with me in this journey and for your support and being part of this community. As I said, this 2023 has been a tough year for me, and I won't make any bones about that. But anyway, I'm making it through, and I'm optimistic, and I'm hopeful for things to come. And check out that chronicle I've done, that video series I've put together, if you choose to. For some people, it might be kind of hard to listen to or watch, but anyway, it's really intended to help others in their journey, and that's why I'm putting it out there, and it's there for you if you need it. So take care, folks, and big thanks to our sponsor this year, Therapy Notes. They are the leading electronic health record system for mental health providers. They're who I use in my practice, and I couldn't work without them. And also check out SimplyPsych, because they have got, as far as being the back end, I think they have got some great solutions for therapy practices, particularly around the marketing and the management of a practice. And I think you can learn a lot from them, but be sure and check them out. And big thanks to all of you for following us and subscribing to the podcast wherever you might be listening to it. And we'll see you, or be with you, or you'll hear from me in 2024. Take care, folks, and the happiest of holidays. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.